We are currently with renowned Ayurvedic doctors Professor Dr. T. Venugopal Rao. Let's talk to them and find out more. Namaste, sir.
Namaste, Amma.
Sir, we have talked about a topic before that diabetes has many complications, and we regularly hear about the common complications when we are at home. They say that they are having burning sensation in their legs and say that the hot burning sensation is worse when they put their feet next to it, and they say that they are getting cramps and so on. It seems to us that this is common in everyone. What is special about them? But only they can understand it because of how much they are suffering. Unfortunately, does such a problem really exist in diabetics? Is there a chance for us to take this a little seriously? Can we really call it a special disease? Please tell us about it. Of course, Amma Dhanvantari, Nama, friends, in those diabetic patients, as you said earlier, there are various complications, some simple complications, some chronic complications, some chronic serious complications. Okay, there
are long-term and serious complications. In that, a condition that matches the symptoms you have just mentioned is
called diabetic peripheral neuropathy. That is, diabetic peripheral neuropathy. In this, especially in addition to these two symptoms that I have just mentioned, are there any other symptoms? Sir, what are they? So, among the symptoms that are especially in diabetic peripheral neuropathy, what is
seen in the majority of them is burning in the extremities.
So, the intensity of these burns is more in some people, less in some people, more in some people, more in one day, and a little less in the same day.
Some people have it more during the day. Some people have it more at night when they are lying down.
Okay,
some people
also have cramps along with these hot flashes. Yes.
Okay, along with these cramps, there is also a numbness.
And in some people, as this disease progresses,
what happens is that the strength in the legs decreases.
So, the
grip in the legs decreases. When we walk, we feel that weight, as if our feet have lost their grip, and we cannot step strongly.
Okay, for
some people, sandals, that is, footwear, normal sandals,
slip off their feet without them knowing.
So no matter how hard they try, they
cannot get that grip. This is called grip loss.
Okay.
So this is also one thing. Some people do not have strength in their legs. This means that after taking a few steps, they have to sit down.
In addition to these, if not in their legs, some people start having pain in their fingers. There
are also pains. Okay. So all these are symptoms of diabetic peripheral neuropathy.
Now if anyone has these symptoms and any tips for this, but what can we follow at home if we delay these problems like this, then there is a chance that they will become more serious.
Of course, Mom.
So what happens in this is that in neuropathy we mean this is what many people now what is it? Now for those who watch this video, what is the most interest, sir? What is this problem? What do you say? What is the remedy for this? Yes. Sir, but please listen to what I'm saying. Listen completely, even if you take a little more time, but watch it from the beginning to the end. It will definitely be useful for those in your house or for you or for someone you know. This is okay. Yes, sir. Watch it patiently, watch carefully. Many people are saying, what is it? All these comments we keep watching.
Yes, they said it so slowly, but this is a video that is being made with the intention of telling us scientifically. You listen patiently, you. So this what happens in this is that in
diabetic peripheral neuropathy, two things happen.
One is nerve damage.
Okay, the
second is blood vessel damage. Blood vessel damage is called vasculopathy.
Okay.
If the nerves are damaged, it is called neuropathy.
So, neuropathy means that the nerves are damaged. That is, the blood nerves in our feet are damaged.
Because just as every cell needs nerves and nerve stimulation, those nerves also need blood flow. Because nutrition comes from the blood. So it is because of the nutrients that come from the blood that our nerves
are healthy. What
happens in diabetic neuropathy is that uncontrolled sugar in the blood.
Sugar control chronic uncontrolled diabetes.
Okay.
If
We have abnormal levels for a long time without normal levels. What happens is that these thin hair-thick blood vessels that supply these nerves to us.
Yes.
So the walls of those blood vessels thicken.
Aha.
Okay, so this is called endothelial hyperplasia. This is.
So that causes oxygen depletion, which means that if the blood vessels are not damaged, if they are not constricted, what happens when they are tight, that is,
the
blood that goes through it does not go properly. What happens when it does not go properly? The nerves do not get the nutrition they need, they do not get oxygen.
Yes.
This is called hypoxia.
So,
What happens when you have this chronic hypoxia is that these nerves get damaged.
okay.
This is called neuropathy.
So in neuropathy, we also have sensory neuropathy, motor neuropathy, autonomic neuropathy. Oh, let me tell you, sensory neuropathy means that the nerves related to touch are damaged. Okay, motor neuropathy means that the nerves related to movement are damaged.
The autonomic nervous system means that after our heart rate, the one that controls the heart, the one that controls the lungs, the one that controls the respiration, the one that controls the movement of the intestines is called the autonomic nervous system. That is, the nervous system that works without our involvement. So the autonomic nervous
System is also susceptible to this neuropathy in some people. That means that
when it is chronic, it comes to age. In those who have diabetes for a long time, it is okay. Okay. So no matter how many medicines they use, it is not under control. Some people are like, it doesn't matter, we are taking medicines, we can eat, there is no problem. In the starting stage, we have this symptom, so we should take treatment. Okay,
according to an observation in Ayurveda, what we have is that the
natures that tell us about the nature of the bile or the nature of the bile, the nature of the kapha, and the dual natures. In Ayurveda, the natures are the constitution, that is, the principles of the body. So, they say hot body, cold body, and kapha body, right?
Yes.
So in them, the hot body is called the bile principle, and
these neuropathy symptoms are seen more in them compared to other body principles.
these are more common in those with a hot body, because it is related to blood and bile, both are related, so it is related to fire and bile, and it is related to heat.
Okay.
So in people with the bile nature, the chances of this happening are more compared to the rest. So this is a reason.
Okay.
So then in Ayurveda, we have these symptoms, which are called ants crawling on the soles of the feet. That is, what happens to us sometimes is that we have a crawling sensation as if ants have crawled on the soles of the feet.
Okay.
Okay, that is also a symptom of nerve damage, crawling sensation. All these are said to be symptoms of nerve damage. Then, latent thirst, latent pain, ants crawling on the soles of the feet. Ayurveda also says that these four can also occur in this and that disease. So overall, in Ayurveda, this is a problem related to Vata Pitta doshas.
Okay. And now we don't know unless you say that this problem exists. Normally, these symptoms are there, but they are normal symptoms, and they will subside after 4 days. They think it's because of some food, or if it's not, it's because they're getting older, or something like that. Sir, is this really a problem? Should I consult a doctor immediately if I have a cold? No, it's just Ayurvedic, which means herbs or home remedies, and if they follow them, will it be enough? My
Main advice is that mom, this is a serious problem.
take it seriously.
Why am I saying this is serious? If we don't control this problem properly at the right time, what will happen to us in the future? I said that the sense of touch, which has become numb, will also be lost.
Yes, so when this sense of touch is lost, what happens when those patients get pricked by something while walking, or if they get hit by a stone, or if they get pricked by a thorn, or if they get hit by a stone, they don't know. Yes, so they don't know. So, there will be ulcers. So, ulcers in diabetic patients are a very serious condition. So, it doesn't heal because vasculopathy means that the blood supply to our veins decreases. The nerves get reduced. The strength of the nerves also decreases. So, when the ulcers don't heal and gangrene forms, and the gangrene doesn't go away, the condition in which that part of the vein has to be removed is called surgical amputation. Many diabetics say that they cut that part and hear things like this a lot. In this diabetic neuropathy, this amputation is a complication for us, diabetic gangrene.
So what is this? When do you have this problem? Now, let me tell you again if you have the symptoms I mentioned. Remember, everyone has.
1. Burning in the legs, the
second is a feeling of being pricked by needles or numbness, a decrease in the sense of touch. Then we feel like ants are running around, we feel a tingling sensation. For some people have difficulty walking, i.e. they do not walk properly, they lose grip, if we wear any shoes, they slip. So for some, such symptoms start in the feet after walking for a certain distance. Because what happens due to this nerve damage is that the muscles that support us there also
atrophy, which means their strength decreases. Okay, so there are
about 178 symptoms of
these. So when all these are seen, if some of these are seen, if one is seen.
Okay then.
You should be careful.
So what precautions do you mean? First of all, do not go for tips about this. My
advice is
sincere advice, because this is a serious problem. Do
not go for tips. Various videos come on YouTube, do not follow them. Also what
you have to do first is to get a doctor, okay?
allopathic doctors give medicines. If you have faith, then take it, no issue, but in Ayurveda to control this, very effective medicines, successful medicines, treatments are there in Ayurveda.
how long should it be used, sir? When it comes to Ayurvedic medicine, they say it should be used for a few months. This medicine does not cure immediately, it works very late. There are various misconceptions. Really, if a patient comes to you with these particular problems that we have talked about, in how many months is the problem likely to subside? Now, they say, sittings, you should use a medicine for so many months, and then you should use it again like this, and then you should take a break and do something like that, like courses of
course, depending on the severity of the problem, the
medicines, the duration of the medicines, the
dosage of the medicines, all these things change.
So, all these are individualized treatments.
So different systems, generalized treatments, generalized medicines. Everyone has the same type of medicine for the same problem, but in Ayurveda, there is no such thing. Each person is individual. The medicine changes depending on the physical constitution of that particular patient, their age, their eating habits, their lifestyle, and how long they have had this problem.
For example, I will tell you that along with the medicines, the duration of the medicines also changes. So, for example, spring safflower is one of the choices for this kind of problem.
There are many. That is a part of the treatment. That medicine is called Vasantha Kusumakaram. It is a herbal medicine. It is a medicine mixed with gold preparation.
In the past, Vasantha was actually sugar. So what were the complications with it? They were not
kings, but landlords. They all used to prepare it at home.
Okay.
Ayurvedic doctors were called in the old days and prepared such medicines for themselves, their families, and everyone around them. They used to prepare it. If you
use it before, it will prevent sugar from
coming. Plus, it will control what has come. This is not just Vasantha Kusumakaram. Now, after Siddha Makara Devajam, there are many other such medicines.
Okay.
So, among such things, I have told you before that Vasantha Kusumakaram is a wonderful medicine. So, this is in the starting stage, that is, one of these. If the problem starts and you take some precautions beforehand, this is a good thing for those who want to recognize it early and take care of it. Let's say it's been 3 months. So it's been 3 months since they came and recognized this problem, and it's been 3 months. For those who are under 3 months, this is a wonderful medicine. So if they use it for 3 months, it means it's a wonderful medicine for them. But if they use it for 3 months, this problem will be completely reversed. Okay.
Back to normal again.
So what happens with this is that other types of complications related to diabetes will also reduce. Vasantha Kusuma is not the only one.
Okay.
Because in diabetes, there are various problems like neuropathy, vasculopathy, retinopathy, nephropathy, cardiomyopathy. Okay.
So we have the power to control all these diseases. We have Vasantha Kusumaka.
Okay, so.
Sir, it has been 3 months.
And Vasantha Kusumakaram is not working. There are those who have
reduced Vasantha Kusumakaram.
Yes.
No, it has been 3 months.
And what other medicine should we use?
So there is another medicine called Swarna Bhupati in this. Because we have to treat based on the doshas. Because I have said before, there are 2 reasons for this problem, Vata dosha and Pitta dosha.
So the medicines that are suitable for these 2 reasons are called Rasaushadhas. These are called Swarna Kalpas.
Okay, and
that, the Vasantha Kusumakaram mentioned earlier. In addition to that, this Swarna Bhupati is a very wonderful medicine for you. Now you should take it, or else you should take it and continue to give it as the main medicine Swarna Bhupati. It
can be used for 1 to 3 months, Okay, 3 months or 6 months, there is no problem. Okay, I will tell you some other types of medicines for this. Later on there's Brihatwada Chintamani. 4.
Those who have a lot of pain.
Okay, after that they lose strength in these and those legs.
That means when they step on the ground.
Yes, it.
Decreases.
Okay.
So this medicine works well for such people.
This golden earth for those who have less sense of touch, that is, we call it sensory neuropathy or neuropathic pain.
Yes.
So it works well in sensory neuropathic pain.
Okay.
So if not, then what is the dosage of this?
What is the dosage of this? How long to use it and how to use it? Use it only as per the advice of the doctor. Now, watch my video and buy what you want. You can go to the shop and buy it.
Okay, they said that, right, Palana?
Sir said, we wrote it down, we went to the shop and, why? I mean, these are herbal medicines. The dosage is very low, that is, in milligrams. For example, Gunja standard means that there is Guruvinda seeds, right?
Yes.
That is the only dose. The dosage of this is.
Okay. These are medicines that should be used in such a low dosage, so they also have
a dosage. So what is the dosage? Should I use it with honey, ghee, lime, triphala, pepper powder, or something else? Doctors, depending on their condition, tell me what the dosage is. So take the advice of the doctor. You consult them and pay them a
fee.
My sir told me on the phone, they don't.
Go and get it. They do all this, that's why I'm saying.
Okay, so along with this, are there any medicines that we can apply to the skin? And this is a doubt for many people.
Yes.
Externally.
Yes.
So what are some oils that work for this? Okay.
What are they, sir?
That, Balagudichiati oil.
Secondly, sandalwood oil.
Then Pinda oil. You can do a combination of these, you can do anything, you can massage it on the skin.
So, there is no need for a doctor's advice for this. I am telling you directly, okay? You can use it.
That means we can ingest it internally, so there is no big
issue.
Even if it doesn't work, it won't have any effect. It won't cause any harm, right? Yes, now you said that, those 3 types of medicine have been mentioned. Now, if you use this medicine for 3 months, then continue it for another 3 months. Along with this, do you have to balance your food? You must balance your food.
Because you have to control your food in 2 ways. One is that after controlling your food for diabetes, we are taking herbal medicines. We are taking golden pills.
Yes.
So when you take them, there is also a food that is suitable for them. Oh, they are good because they are very costly medicines. They are very, very costly.
So when you take such costly medicines they work fast, they are called Shipramarogyatiyatwat Aushadebho Adakorasaha. That is the same as Alpamatropa Yogidavat Arush Aprasangata Shipramarogyatiyatwat Aushadebho Adakorasaha. What does this mean that even if you take it in small doses, it will
not taste good? Some people do not like the taste of Ayurveda medicines. They do not like the color, they do not like the smell, and all that. After taking them, some people feel a vomiting sensation. Yes, some people make 36 different gestures like this. Okay. So there is nothing like that. Even if you take it in small doses, Shipramarogyatiyatwat Aushadebho Adakorasaha.
Herbs are a very big topic. I am explaining it in detail.
So these herbs work quickly for us. There are not just the 3 mentioned now, there are 36 types. We can make all of them in combination, which is useful for us.
Okay.
Now we can make some oils externally. There is no problem with that. In terms of food, one is when using eggplant, one is gongora, one is tamarind, one is pickled vegetables.
These should be stopped. Why are these 4 things I'm telling you to stop? That is, salt is not good, these spoil the blood.
According to Ayurvedic theory, they spoil the blood. When the blood is damaged, the blood vessels are damaged. When the blood vessels are damaged, the nerves are damaged. When the nerves are damaged,
yes, total damage occurs.
Damage plus means that we have these opposites. The properties of these are opposite to the medicines we use, but when we have these opposite properties in the opposite direction, the medicine's action is nullified. Okay, so even such a costly medicine will not work.
Otherwise, it will work less and less.
Okay.
So we have to do this. Then related to this is another very important part that I mentioned. Now this is how important it is. What is twice as important as this? What is Panchakarma treatments like?
Sir,
In this treatment called Panchakarma treatments, we have Vasti Karma. I am telling you to understand what Vasti Karma is. It is just like an enema, but it is not an enema. That procedure is like an enema except that it is not an enema.
Why is the process of inserting this medicine through the anus called Vasti Karma? Okay, that is the place where we have the Apanasthana, the anus, the skin, reaches the Apanasthana from the bottom.
So how do we imagine a tree withering? Where do we pour water? It is not only below, but also above. The
Water is the
same.
So similarly, the source of the nervous system is the
gut, the place where we have the Apanasthana, the gut. Now everything is
called gut health, right? In Ayurveda, it was once said that gut health is good.
So if this is good, then this is good, that is, the gut-brain axis is.
Okay, that is.
It is restored. By giving this here, we get okay, and in this, we have that Panchatikta Panchaprashrita Sagruta Shiravasti. So in this, medicated herbs, that is, some types of herbs are made into a decoction, and more than a decoction, it is called Shirapakam, which means that they are boiled in milk, poured with water, and then cooked. We add ghee to it, which means we mix it with good cow ghee and some other herbs, and now we give it like an enema.
So this method should be given for some time. Depending on the severity, it should be given for 15 days, 30 days, 40 days a month.
So, giving it every day, some people give a gap of 10 days, then give it again for 10 days and do it again for 10 days. That is, it takes 10 to 30 settings. Anyone can take it.
Anyone can.
Take it from the first day the problem starts.
Okay.
We are seeing this in many patients. We have very excellent results.
Now, 30 sittings approximately. That is, how many months will it take?
That is, if you give a gap of 10 days, it will take 30, that is, 1 to 3 months.
So,
Okay.
So we should give it for 10 days, give a gap of 10 days, again 10 days, again like that. 2 months, 3 months, how much is that calculation?
So according to that, some people may take more. So what we do in between for some people is that we also give them oil Vasti. So now we do this Vasti ritual with oil too. Some types of medicated oils.
Okay.
So with Kashaya Vasti we have a little bit of oil Vasti and a little bit of all these work in a synchronized manner, and
these nerves, the damaged nerves, have a chance to recover. The
blood supply is restored again.
Okay.
When the blood supply is restored, the nerve damage is also likely to be restored. Of course, we have seen it. We told many people and said,
Okay.
After this, what is in this? In some people, we have a medicine and an oil that our team has prepared.
Its name is that diabetes oil, so it should be taken internally, taken externally, and used in these 3 ways. Diabetes oil
is a wonderful medicine. So, in this, inflammation is reduced, pain is reduced, and the sense of touch is restored. So, we prescribe all these to the patient as per their needs.
Okay. Even though the topic is really long, I must say that all the information has been covered in this topic. If you really see a symptom, then there will be this tension. All that will also be cleared. This video will clear the video. It is a courage for them. Now many people call me, saying that after watching the topic you mentioned, sir, we have gained courage.
We were fed up with taking a lot of depression medications and injections. After you said that, we got courage.
Yes. Treatment is also beneficial for the patient. Even after listening to these words, most of the
people from the film industry and politicians come to me and say, okay, thank you sir, thank you very much, Jai Ayurveda. Quote,